Hey everyone, welcome back to On the Stand with Ashish Arun. I'm really excited about today's episode because we've got an incredible guest with us, John Puls. He's a licensed clinical social worker, an addiction specialist, and someone who's been making a big impact in the world of mental health and addiction treatment. John's the founder of Puls Therapeutic Solutions and has spent years helping people through some of the toughest challenges, whether it's substance use disorders or severe mental health issues. He's also got this fascinating side to his career as an expert witness, where he's testified in some pretty high-profile cases relating to addiction and wrongful death. On top of that, John's been doing some amazing work in crisis intervention, teaching future social workers at Florida Atlantic University, and staying on the cutting edge of research around things like cannabis-induced psychosis. We are going to dive into his journey, hear some stories from his time in the courtroom, and learn about the challenges he faces in the mental health and addiction world. I know this conversation is going to be eye-opening, so let's get right into it. Hi, John. Welcome to the show.
Hi, thank you for having me.
It's a pleasure. So let me start with the origin story of John Puls. So your work spans both clinical practice and expert witness work. So what really drew you towards, especially addiction and mental health?
Sure. So I began working with addiction and mental health a little over 10 years ago. Mm-hmm. And so I was originally drawn to it. I have a family of, psychologists and psychiatric nurse practitioners. And so I've always drawn to it, but I was particularly drawn to the field of clinical social work. Mm-hmm. And so I began working in, various roles in substance use disorder treatment and mental health. And I started in like a support staff role, so essentially a behavioral health technician. And then I eventually became a case manager and started working as a primary therapist. And currently I do both individual, family, and couples psychotherapy, predominantly surrounding addiction and severe mental health.
And it's a challenging field, to say the least. Like giving therapy by itself, you have to have like a certain level, certain kind of personality. And I say this because my wife is a psychiatrist. So, I've seen the kind of work. This work can also be very stressful. And then on top of that, you also found the courage to also do legal testimony work as an expert witness. So let's talk about some of the challenges that a professional like you faces as a therapist, and then we'll come to the expert witness work.
Yeah, absolutely. It is a challenging field. And I've also, to make it more challenging for myself, I've decided to specialize in particularly difficult populations, challenging populations rather, for both substance use disorder and severe mental illness. And, when I think back about that decision, I just always felt a passion for it. And where many other of my cohorts throughout graduate school preferred to work with easier going populations perhaps. But beyond that, as far as how I got introduced to the forensic work, because many therapists like myself stay as far away from the courtroom as humanly possible and go to great lengths to never appear related to any legal proceeding. I originally opened up my own practice. And not too long after that, somebody had actually, believe it or not, made a Facebook post where they were asking for an expert witness for a lawsuit involving an addiction treatment center. Mm-hmm. And I thought to myself, I could probably do this. I had previously done some forensic work related to what's called the Marchman Act in Florida, which is it's basically an involuntary commitment for substance use disorder. So I've been in the courts before. I was used to writing assessments, and that's how I started working in the personal injury and wrongful death space.
Wow. So involuntary commitment is a very thorny issue, as far as I understand, because it's very necessary if the patient does not have an insight into their illness, but at the same time, it can also get abused by family, by people, depending on the circumstances. So can you talk to us a little more about the Marchman Act and what has been your experience working with patients who have been committed involuntarily?
Sure, absolutely. Yeah, it's a topic I feel pretty passionate about, and it's a very unique law. So first and foremost, the Marchman Act is specific to Florida, the state of Florida. So outside of Florida, it has no merit and no standing. But essentially, what it is the Marchman Act it's an involuntary commitment for substance use disorders specifically. So whereas traditional involuntary commitment is for people that meet what's called the dangerousness standard, but only in terms of mental health. Typically, substance use disorder was excluded from that. So the traditional dangerousness standard was a danger to yourself or others due to someone's severe mental illness. That can be due to suicide, homicidal ideations, severe psychosis, inability to care for oneself. But the Marchman Act is specifically for substance use disorder. And basically, the way that it works in a nutshell is that a concerned individual, typically families, petition the courts down here in a very separate civil commitment mental health court. And it can be granted on what's called an emergency basis or on an ex parte order where a judge will actually sign off on it. And then a pickup order can be granted so that the respondent, who's the person being Marchman Acted, can actually be picked up by law enforcement and taken to an addiction treatment receiving facility on an involuntary basis. And then they're held there during the assessment period. And then during the assessment period, someone like myself, like a licensed clinical social worker or other qualified professional, will complete the Marchman Act assessment and determine what level of care that person needs to be in. And then so essentially after that, there's a hearing where the person can either agree to the treatment order and the recommendations, or they can contest it. And if they contest it, there's essentially, as strange as it sounds, there's a litigated hearing where the respondent has an opportunity to defend themselves, and they'll be represented by an attorney. And the petitioners, who is mostly family, will also have the ability to state their case as to why they feel their loved one needs to be involuntarily committed. And then someone like myself would have to give testimony, be cross-examined on their assessment.
And you can be retained by either of the parties, or would the court also appoint an expert to do the assessment in these situations?
So I can be retained by either the petitioner or the respondent.
Okay.
And essentially the way that works is that, typically the attorneys would reach out to me. Now, it's a big issue, I guess we could say, is that the courts actually, unlike other cases where the courts can actually appoint an expert witness for other cases, for Marchman Act court, they don't. So the court will not pay for an independent expert. So basically the cost of that has to come from either the respondent or the petitioner.
Right. That's interesting. And you also do a lot of wrongful death litigation now, even though you started with Marchman. So what kind of cases do you see with substance abuse and wrongful death issues?
Sure. So with substance use disorder, and there are a lot of addiction treatment centers throughout the United States, and there's a high concentration of them actually in South Florida, where I'm located, and throughout the state of Florida. It was often referred to as the recovery capital of the world. And so what's interesting about addiction treatment facilities is that obviously you have a high-risk population, and there's certain standards of care for addiction treatment by qualified professionals like myself. And so usually the cases that I'm involved in, the patient has either died by suicide or overdose, either in the facility or shortly after leaving the facility.
But in these cases, have you noticed a certain kind of prejudice? Because again, it's substance abuse, somebody who's, I'm not qualified to categorize substance abuse as the fault of the person or whoever's fault is it. But that's not what we're trying to do here. But have you seen a certain level of prejudice or a lack of understanding, if that would be a better way to put it, in the legal system, maybe on the part of the court and the jury, where something like this happens and they may not look at the person as a normal human being, or there would be a prejudice that, if they have died by suicide or if something has happened, it's more likely their fault because they are in the grips of substance abuse?
I would say most of the time it is a lack of understanding. And at times, unfortunately, I think there's a prejudice because, for two reasons in both cases. When it comes to the overdose death, people often view addiction as a moral failing and a choice.
Yeah.
So the argument typically is, is it not true that the person chose to do the drugs. No one forced them to do it. And so this is where we go into about an understanding of addiction as a severe mental illness. So the example I typically give is that, people suffering from major depressive disorder, generalized anxiety disorder, schizophrenia, bipolar, that's not a choice for any of those individuals, and more specifically, nor are the symptoms associated with it. So, for example, somebody that has borderline personality disorder is more prone to self-harm and cutting. So you may say, well, that person chose to cut themselves. And my response to that is, well, the cutting is a symptom of their mental illness. In the same way that someone's substance use is a condition of their substance use disorder, which is the diagnosis in the Diagnostic and Statistical Manual for Mental Disorders. And I will say that people suffering from addiction often aren't very sympathetic, and they're not very sympathetic victims or sympathetic plaintiffs at times, and so I've seen that as well.
And I also wanted to touch upon the cannabis and the fentanyl crisis, because you have given several presentations on these issues, and fentanyl, we keep reading about unfortunate events surrounding fentanyl addiction across the United States a lot. So what kind of trends have you seen when it comes to these drugs, and how do these trends impact your role in legal cases?
I'll start with the fentanyl and Bridget, how that impacts my role in legal cases. So obviously, somebody that is addicted to heroin or other type of opioids, we're always at risk for overdose. That was always a fact. People with addiction have been dying from overdose for a long time, but fentanyl kind of kicked it into overdrive. The fentanyl crisis came into play because it's very cheap to produce. And so therefore, people that, drug traffickers are putting it into the drug supply system because it saves money. It really comes down to an economic issue. And as a result, it's kind of flooded into what people believe to be heroin. People often believe they're purchasing prescription opioids on the street and illegally, and they're pressed into a pill that's actually fentanyl. It's being found in cocaine. And so how that's impacted my legal practice is that the rates of overdose have skyrocketed. So, the most recent data from the Center for Disease Control in 2023 was that opioid overdoses in the United States were, I think it was about 82,000 people had died. So if we really think about that number, and so what happens is that, we know that people are at greatest risk of overdose death after their tolerance has been lowered. So after they haven't had the substances in their system. And so if somebody relapses either in an addiction treatment center or mental health facility, they are more likely to suffer an overdose because they've had a period of sobriety.
And you've also given depositions in some high-profile addiction treatment center cases surrounding wrongful death. So do you think just the very fact that these cases are high-profile and there's media scrutiny around it, does that impact the way you approach these cases? Are you more careful than the regular ones? How do you differentiate there?
Sure. Yeah. That's a great question. So I would say at face value, I always approach every case the same, regardless of if it's been in the media or not. There's certainly a recognition on my part that I could be approached afterwards or during, given the high profile nature of it. But I look at it as at any other case that I'm working.
So let's come to the learning curve of, transitioning to an expert witness. So when you started and you got your first case, and it was the Facebook post you told us. So did you feel at that point that, okay, I'm prepared to be an expert? Or because a lot of your colleagues, like you said, they want to stay as far away from the courtroom as possible. So did you feel that you were ready, or did you how did you prepare for that first deposition? Maybe it didn't come in that case, I'm not sure. But how did you prepare yourself for the first deposition, the first cross-examination?
Sure. So it did not come in that first case. But as far as feeling prepared, so I at least had the experience of being in Marchman Act court many times, and having to be cross-examined on the stand by a very, very good attorney who's the predominant public defender for Marchman Act cases. He's very good at what he does. And so I had that experience, which I felt prepared me. However, being totally transparent, I didn't really know the world I was walking into when it comes to like wrongful death and personal injury civil litigation. And how I prepared for the deposition is I just made sure that I re-reviewed the medical records. I made sure I had on the top of my mind ASAM criteria, which is the American Society for Addiction Medicine, which determines best level of care for how the individual with addiction is presenting. And so I prepared in that way, but I later sought some additional support and training when it relates to the courts.
And do you have any anecdotes from depositions and crosses? Like, what was the experience like?
Yeah, so the way I always explain it is that my experience when I've either been, cross-examined by either the plaintiff or defense attorney, because I do work for both, is that it typically goes in a few different phases. The first phase is my background, my experience, my work experience, my CV, and then gets into a general understanding of addiction and mental health, suicide, if that happens to be the case. And then finally into the actual case at hand. And my experience has been, when given a deposition, is that it's important that, obviously the attorney on the other side, their job is to zealously represent their clients. And so I think it's important to, not take anything personal. I signed up for this. I volunteered myself for that role. So, any unpleasantness that I may experience is due to, my decision to do this type of work. And so I make sure not to take it personal, and also realize that, my experience is that when there's a lot of focus on my credentials and background, and almost, I wouldn't quite use the word attacking, but trying to get me unrattled or rattled related to that. My general experience has been that's when the case on the other side isn't as strong. And so I just try and keep my patience and be very intentional, and listening is huge. Listening to what is the actual question being asked to me. As a both an educator and a psychotherapist, I talk a lot. And so, depositions are structured much differently. So I have to be very intentional about answering the question.
No, I mean, if I was an attorney and I was, deposing a licensed psychotherapist, I wouldn't try to rattle them. I would be sure that, that would be very difficult. And I've heard this from a lot of attorneys and experts, that they usually go after your credentials, or try to go after your credentials, and not the science, only when they don't have a very strong case. So the fact that you are reaffirming that is also reassuring for new experts, because this is something that many experts fear, the deposition and the cross-examination. And there's a usual conception that you have to be really thick-skinned if you want to do well as an expert witness, and it's not for everyone. But I really think that it's really important for especially medical professionals and psychologists and psychotherapists to come forward and provide this testimony and assistance, because if somebody has been wronged and they cannot find the expert representation that they need, like an expert witness to confirm the malpractice or the wrongful death, then it's very difficult for them to get justice. So experts are really important, and thank you for doing what you're doing.
Oh yeah, absolutely. And so what's interesting about the work that I do is that, with the exception of 2 law firms that I've worked with, most of the time I'm working with a firm that's never worked an addiction treatment center case before, or an attorney that's never worked it. So there's a high learning curve often. And so I think it's harder often for opposing counsel to attack the care and what I'm saying, because they're not as familiar with it. So my experience has been they'll go after my credentials sometimes. But there's 2 firms. One is a plaintiff firm, one is a defense firm, that one of their specialties are addiction and mental health related cases.
So they would not really focus on these aspects, and they'll know where they want to focus on the case.
Correct.
And do you think the jury, like the attitude of the jury, has changed towards the fact that an expert would have a website, or they would, like be available, they would maybe list with a listing service? Like, like, have you really faced these issues as like a concern from the
Yeah.
retaining
So
attorney or the jury?
I have not faced those issues as a concern. I've heard that those are issues, that a lot of experts they won't have a website, or they won't list on a directory of any kind out of fear that will be somehow used to discredit them. Perhaps my experience is unique in owning my own practice, where in order for clients that are seeking psychotherapy or addiction counseling services, they have to know where we are.
Yeah.
Right? They have to be able to contact us. And so it always seems like, and my understanding of the human psyche and human behavior, I just can't imagine that it would be that impactful for a jury to know that I had listed myself on a directory or have a website. Because the easy response is, well, how are they going to find me? You know? And the truth is that I do a very niche area of expert work. And so it may be even harder to find me. And the comments I frequently get from attorneys is, you were the only person I found that was able to do this type of work. So if I was hiding, how would they find me?
No, I mean, I'm absolutely with you on that.
Yeah.
In fact, this is a biggest challenge that attorneys who work with medical professionals face, because not only do they not list or they don't have a website, their contact information is also not easily available. So even if I find, like we gather expert information as a primary product for our company, and we'll find a lot of experts being deposed and disclosed in different proceedings. So we'll have their resumes. In fact, we'll have their date of birth, because a lot of experts put their date of birth on their resume. And so pro tip, don't do that to anybody who's listening. And but their phone numbers and their email addresses will not be available. Now, I have been told by some medical experts that they don't publicly publish their direct phone number or email, because then patients try to reach them and make an appointment. Has that been a concern in your case, or it's perfectly fine?
No, it's perfectly fine. So most therapists that I know, psychotherapists I know that own their own practice, they have either their direct cell phone or some type of application that goes to their direct phone for patients to be able to contact them for mostly scheduling purposes. I do have, the practice I own has several other clinicians located in the practice, but again, people have to be able to access us. So patients often have access to be able to contact me directly. And my stance was that with attorneys that I'm working with, there can be deadlines that come up suddenly. There can be changes in a case. I've always felt that accessibility is important when I'm working with somebody on a professional basis. The feedback I've gotten from attorneys is that they appreciate that. They appreciate the accessibility and being able to reach me.
Yeah, you wouldn't believe it. A few weeks ago, I got a call from an attorney, and he was trying to contact his own expert, who he had retained a couple of years ago, and then the expert had done some preliminary work, and then the case got pushed. And 2 years later, now the next stage was coming up, and he was unable to contact his own expert. So this is a real problem, and really, I mean, anybody who's listening, and if you're an expert witness, please make sure that you're accessible. Like John said, a lot of times he's the only expert who attorneys can find. So I think just by being accessible, you're ahead of 90% of the competition, like if you want to call them competition.
Sure.
So
absolutely.
Yeah. So you have, you teach, you do psychotherapy work, you write, you publish extensively, you present at conferences and seminars. You also do media appearances. I know it's difficult to pinpoint and put your finger on one of these activities. But what do you think has helped you the most in putting your name out as an expert witness? And what has brought retainers and attorney clients to you?
As far as getting my name out there, so I first of all, I really enjoy presenting on various topics, especially topics that people aren't familiar with. So, I won't list them all, but on my CV, you can find a mostly updated list of all the various professional conferences and professional organizations that I presented at. And I would say, as far as getting my name out there, that is probably one of the most effective. I'm able to do the conferences or the presentations both virtually and in person. It allows me to connect with qualified professionals all across the United States, which has been really helpful. And then, The media appearances too. There's a few topics that I'm able to provide a lot of expert review on a broader scale to just explain a certain issue. For example, I recently gave kind of an expert's overview on a news station about ketamine. And when Matthew Perry tragically passed away, and so just kind of overviewing because we're seeing ketamine a lot in the mental health field now, and so kind of giving an overview of that. I enjoy doing that, but I would say in terms of what's more beneficial for me professionally and what I enjoy doing more is the professional presentations.
Mm-hmm. Let's talk about the legal knowledge that an expert should have. And then let's probably also talk about the soft skills. So I'm sure you're aware of the Daubert standard and the rules, the federal rules of evidence, and then you have your own state rules in Florida, and then other states have their own rules. So how did you read up on them? Did the attorneys who retained you, they guided you, they helped you understand the laws as they apply to expert witnesses, the disclosure rules, how the reports should be written, what should be the format? How did you go about learning about these things?
Sure, it's a great question. So it was quite the learning curve. I despite my Marchman Act experience, it didn't fully prepare me for all the proceedings. And fortunately, there's no expectation for me to have the same knowledge as an attorney.
Oh yeah.
However, it's very important for experts to have a basic understanding of how this type of litigation works. And what I always say is that for anybody that's interested in doing this type of work, hopefully the attorney is willing to answer questions. I think a lot of times people will feel pressure to know something that they don't know. But again, they're attorneys. You're not. If you're unfamiliar with the legal proceeding, ask. And I've been fortunate that many of the attorneys I've worked with have been very forthcoming. They'll even explain how proceedings work ahead of time, and they're always willing to answer questions. And so I've been fortunate in that regard. And I almost feel like the favor's been returned because I often have to go to extra lengths to explain to them addiction treatment facilities and mental health facilities and crisis stabilization units and suicide. And so I'll often, ask them as well. So they've been, very helpful. And then, my own research and understanding legal proceedings and just researching Florida law, because a lot of my cases are out of Florida, although I've, worked cases in about 8 other states, I think now as well.
And you've been very kind to, when you've been talking about the attorneys you've worked with, you've been very complimentary and very kind. Let me flip it a little and ask you, what do you think attorneys would do better based on your experience working with them?
Sure. No, that's a great question. So I understand that often attorneys are juggling many cases. Yeah. I can certainly sympathize with that. But I think what ends up happening is that, and like most experts, I have a very full clinical practice as well. This is not my predominant source of income by any stretch. This is not what I do predominantly. And so if they're coming up across a deadline, the biggest issue I always have is they want a report submitted. I just had this, not too long ago, and I did agree to take the case. I understood it was on a tight timeline. The timeline ended up getting moved up, and it made it even harder. So one of the things, feedback for attorneys would be to make sure that your expert has adequate time to review the case and write the report, and to understand that often this is not the expert's primary job. And they're often still in clinical practice. And then, the other part is, and I've experienced this, and I wish I had been more prepared for this, but I'll often, an attorney will speak to me on an initial consult call. They'll be very confident about what has taken place, but the records and the information do not reflect that. And so I think what I would tell the attorneys is that, experts are not just hired guns. We are, clinical professionals that have developed an expertise and a skill set, and that even if they feel very strongly about a case, they have to defer to the experts and understand that we will end up saving them a significant amounts of time and money. if they're willing to kind of follow our conception of the case and understand that it may not be a viable case.
Yeah. So do attorneys do some internal assessments first, like maybe go to a nursing consultant or have somebody in-house? And would you be the first point of review usually, or would they have gotten a preliminary review done from somebody, gotten a medical chronology done, and then come to you with the records?
So typically what I've seen for like cases like mine, because again, it's a very niche area.
Yeah.
There's not a lot of people that are doing it. At most, they'll have a timeline set for me so that I can kind of see it, which is helpful. But I mean, of course, I'm going to craft my own timeline regardless. Right. Really, the only thing that I ask from attorneys is that everything's organized in some type of, PDF, Dropbox type format. That's some other feedback I give for attorneys is that if they do have, paralegals that are working it, to make sure the medical records are organized. Because otherwise, I mean, it's going to cost way more for me to spend the time to organize them than it would be to have that organized to begin with, and it ends up delaying my review in the case.
And again, I mean, you have your practice and you have the expert witness work. And like you said, attorneys need to understand that, you are not doing expert witness work full time. And, and I cannot, not see the irony in that, because every attorney wants an expert. Like they would describe the ideal expert who has a practice and does a couple of cases on the side, that they're not doing expert witness work full time, especially in the medical field. But like you said, when it's the case, when they have a deadline, and they would come to you and they would expect you to drop everything and become a full-time expert witness. So I mean, I really found that ironical and funny at the same time, because we keep hearing from attorneys who are looking for experts, oh, this is the ideal expert. And they would always say, okay, medical professionals, find me somebody who's active clinically.
Sure. Yeah, no, absolutely. I mean, it is absolutely ironic. And the other thing is too, I think an attempt to discredit experts often is to say that, I couldn't pay my mortgage without doing this type of work, which is of course not true. And so they attempt to discredit experts in that way, but yet want them to have a clinical practice, and at the same time want them to be able to drop everything. And I have patients, and patients will have to take priority.
Yep. So how has the litigation landscape evolved over the years? Like, are you seeing more cases for wrongful death and malpractice against addiction centers, or they've been steady, there's a decline? What is happening?
Yeah, so it's really interesting. So I'll try to answer this question as concisely as possible. So, so when the Affordable Care Act happened, all of a sudden, adult children who had been booted off their parents' insurance were now able to stay on their parents' insurance till the age of 25. Simultaneously, the opioid crisis was ramping up. So what we had was a ton of young people who now had health insurance benefits to be able to go to private addiction treatment facilities. Okay. While simultaneously with the Affordable Care Act and all those other people being insured, many addiction treatment facilities expanded, opened up new programs, private equity firms got involved, and then the opioid crisis was happening. So you had a combination of much more patients, much more facilities, and there was a lot of growth that happened pretty rapidly. And as a result of that, not everyone that was opening facilities, I'd say, had adhered to the best standard of care. And also, it's a very high-risk population. So, on the defense side, when you have a loved one that dies, right, even if nothing was breached and the care provided was more than adequate, families often want to, have answers as to why their loved one died in the facility that they were supposed to be getting help from. Yeah. And so, but the short answer is yes. I think because of those factors, I've seen a large growth in civil litigation related to wrongful death. And I will add, too, that this is not just in addiction treatment, but also in mental health facilities. And I've had some cases involving crisis stabilization units, which are Baker Act units in Florida, involuntary commitment for mental health. So in both mental health and addiction treatment, I've seen more litigation coming out of it.
And let's also get your take on artificial intelligence, because this is something that law and even therapy are a few of the fields that people are touting that will get impacted by AI. So from whatever you've seen till now, and apps are coming up where, like you can talk to an avatar and you can have a conversation. So whatever like little innovation we have seen in this regard, what's your take on AI impacting therapy work and maybe even expert witness work?
Sure. Yeah. So it's a great topic that, my colleagues and I talk a lot about. Perhaps I'm naive, but I always find it hard to believe that any AI could replace an in-person psychotherapist, right? I think the one of the largest benefits of psychotherapy is the human connection and the connection with the other person and the relationship built. I find it hard to believe that AI could replicate that. I may be eating my words in 40 years. I don't know. But what I will say is that AI, from a clinical documentation standpoint, I have seen a lot of colleagues utilizing it. I personally don't. And I think perhaps it's in old school nature in me. Perhaps it's because of the cases that I'm involved in legally. I just, I picture, what I want to say that, artificial intelligence wrote my clinical documentation in a court case. If I was ever involved in any litigation, I probably wouldn't want to say that. And so, but that's what I've seen it really predominantly used for, is for documentation purposes, setting up treatment plans, editing it and things like that. I've pondered how AI could work in the expert witness area. I've known some experts that just to kind of see what it would come up with have had AI summarize medical charts, for example. And again, I personally have not done that, but the feedback I've gotten from experts that have is that they do like a moderately okay job. They meaning AI. AI does a moderately okay job, but but it does miss some key points. So I don't think the technology is quite there, but I could certainly see a time when artificial intelligence would be able to review records and determine whether or not there was a breach. But I think there's always going to be nuance in this type of work, and I struggle to believe that AI would be able to pick up on that.
Yeah, I mean, even like there are a few new startups that are offering medical chronology services or deposition transcription and summarizing services. And but I think it's difficult for AI to replace the experience that a professional has. Like even when you're summarizing or even if you are doing a chronology, and like a professional knows what's important and what's not important. So I'm pretty sure again, like the machines would learn with training, and they may get much better in the future. But today, like the ethics opinions are coming out from the state, many state bar associations have issued ethics opinions for attorneys, and even though that has not been extended to experts, but I'm completely with you on the idea that as an expert witness, we are not there yet. And if you're thinking of using artificial intelligence for your expert witness work, it's better to wait and watch and be sure that the technology would, again, like just as an expert, you have to meet the Dobbert standard. The AI also needs to, meet the same standards.
Oh, absolutely. And then the other piece that I think about is, even though, as we know, the vast majority of these types of cases are resolved prior to court, some of these cases do go to court and to trial rather. And I wonder how a jury would feel about opinions being predominantly submitted by a robot or AI, as opposed to a credentialed expert with lots of experience.
So is there any innovation in mental health and addiction recovery that you've seen in the recent past and are excited about it?
Absolutely. So there's a couple things. So there are apps that are very promising, but beyond that, one of the things that's most important, especially when it comes to addiction care and long-term care, is follow-up and what I would call recovery management. So what technology and applications have done is offer a very streamlined way for providers to follow up with their patients in between when they may be actually in the office. And so what that does is, because people with addiction will often benefit from multiple touch points and care touch points and check-ins throughout the week in various capacities, and accountability as well. And so technology and various apps have been able to fill that gap in a much better way.
So what advice would you give to somebody who's from your profession, or generally a medical professional, and wants to do expert witness work, wants to get started? What should they do? How should they get started?
I found it incredibly rewarding. It allows me to work a different part of my brain and focus on quality, and really educate and advocate in an area, in a field, in a psychiatric field, also medical field, that is very misunderstood and very not well understood by many people. And so the advice I would give is that, you have to be, passionate about what you do, very knowledgeable, understand that civil litigation can be inherently conflictual field, right? And so there may be a lot of conflict, and you may at times feel even aggressive, depending on the attorney that is deposing you, and just being okay with that. And then also, understanding that the stakes are high with expert work at times, right? And most importantly, everything you write and say will follow you. So, being very, mindful of that, because that's, one of the main things that are asked in depositions are what previous depositions I've given. And my understanding is that part of the reason that is to find any perhaps statements that are in conflict with what you're saying now. Yeah. So just remembering to be consistent and stick with your ethics. You will have attorneys that will try to push you on something, and just remember that, you have to stick with the ethics, and in this case, the psychiatric care.
Oh, yeah. I mean, I completely agree with all the points you've made, and especially with the part where you said that it all follows you, because not just the deposition transcripts, articles you've written, comments you've made online, anything you say, this podcast, it's all going to be in the public domain. And the only standard is, if you're not going to say this in court, don't say it on social media. So,
right.
We have this testimonial on our website from this senior trial attorney who's been using our services for a good 15 years now. And one of his key uses is to identify an expert's testimonial history and then get their old deposition transcripts. And he's in fact found that experts have been taken a completely opposite position in a different case, but similar case in the past. And now they have made a 180-degree turn in his case, and he's been able to use that against experts. So consistency is paramount, and ethics, we cannot stress enough on the importance of ethics. You are an expert witness, you are an ambassador, and you are there for the science, you're not for the party. I think that's also something that is really important for experts to understand. So, John, this has been great. I learned a lot about science, about mental health, about expert witness work. Any final comments you want to leave our listeners with today?
Thank you. No, this has been great, and I really enjoyed it. And the only final thing I would say is that I've greatly appreciated being in this line of work and this type of forensic work, and I hope it'll continue for a long time.
Thank you so much, John. Thank you so much. You were great, and talk
soon.
Yeah, thank you. Bye-bye. If you found this podcast useful, remember to subscribe and give us a review on Spotify, Apple Podcast, YouTube, or wherever you listen to podcasts. This will help other users find this podcast and benefit from the insights shared by our guests. If you'd like to be featured as a guest on this show, please write to media@xlightum.com. See you in the next episode.